Okay, we can go ahead and get started. Hi, everybody, and happy Friday, and welcome to the March CodeX Community Practice Meeting. My name is Anthony DiDonato, and I'm the Community Support Lead for our CodeX community. We have a really full agenda for today's call, so I'm just going to highlight this slide, and we'll jump right into the agenda. So first on the agenda today, Liz Canzone and Sue Chen will be sharing some exciting mCODE and CodeX related updates. Next, John Kildea and Kayla O'Sullivan-Steben from McGill University will be highlighting the Quebec SmartCare Consortium and that team's vision and future plans for adopting health standards. John and Kayla will also be sharing updates to Opal, a patient portal designed by the McGill Health team, and the portal's implementation of the mCODE radiotherapy profiles. Following the presentation from John and Kayla, Arthur Hermann from Kaiser Permanente will be sharing an overview of GenomeX, a new foundational genomics domain which is being launched within CodeX. And finally, George Neyarapally from the FDA and Michele Galioto from Oncology Nursing Society will be providing a status update and call to action for the CodeX risk evaluation and mitigation strategies, or acronym REMS use case. So I'd like to turn it over to Liz Canzone, who is a principal human factors psychologist in the Health Technical Center at MITRE. Liz received her doctorate from Old Dominion University in human factors psychology with an emphasis on improving patient safety through the use of medical simulation. Since coming to MITRE 10 years ago, she has led multiple projects and is currently leading 3 supplementary mCODE studies focused on the routine care setting. Liz, would you like to provide the update?
Thank you, Anthony. So this is just really an introduction to this new routine care study where we're looking at demonstrating the value and impact of mCODE in routine care. By routine care, we mean typical clinical treatment for all cancer patients that occurs outside of a trial. We're currently working with 3 health systems, including Oncoclínicas in Brazil and our partners at Alliance Data Innovation Lab, who are also CodeX members. And the intention behind this is just to look at if we can identify best practices for capturing structured data collection in the routine care setting. We anticipate that these results will inform future enhancements to mCODE and optimize those clinical workflows so that data can be captured at the point of care. And today is really about introducing this new study. We have a lot of them starting, and there's a 1-pager available to you all to give a little bit of information. But we're also interested in hearing from any of you that maybe have implemented mCODE in routine care. We'd love to hear about your progress on that. And we will definitely be following up over the summer and into the fall with interim results and findings, and we'll be sharing what we've learned along the way. Thank you, Anthony.
Thanks, Liz. And I put a link to the 1-pager into the chat, just for everybody's awareness. And I also just quickly wanted to highlight our upcoming April community practice presentation. Nicola Chihorik from Womido, which is a Swiss-based company offering software solutions to help accelerate and simplify data-related processes and clinical workflows, will be sharing updates to and providing a demo of Womido's implementation of mCODE thus far. Into the CodeX updates, Sue, would you like to give an update to the community?
Yep, that sounds great, Anthony. So hi, everyone. I'm Sue Chen. I'm the clinical director of CodeX. I hope that you had a lovely first week of spring. So first, I wanted to start with a warm welcome to some new CodeX members, Evernorth and the FDA. Evernorth is a major industry leader. They bring together and coordinate premier health services offerings to deliver innovative, flexible health solutions for health plans, employers, and government programs. As a torchbearer for affordable, predictable, and simple healthcare, we're really fortunate to have them as one of the champions of our prior auth use case, and we're really excited and it's been a total pleasure working with them. We're also thrilled to announce and welcome the U.S. Food and Drug Administration as a CodeX member, and as the champion of the REMS integration use case, addressing interoperability needs related to the FDA Risk Evaluation and Mitigation Strategies, or REMS, drug safety program. And while we are going to hear more about this use case in just a bit today, I just wanted to say that working with the FDA has really been a testament to their commitment to the mission of protecting and promoting public health. So we're really appreciative of both the FDA and Evernorth and the leadership, not only on these use cases, but also look forward to benefiting further from their input and thought expertise on our CodeX operating committee as well. So welcome. I also wanted to note some news on the federal front. It's been an exciting time at CodeX and as well as on a national level. So for those of you who haven't heard, President Biden recently reignited the federal cancer moonshot and thus put further national onus on really making further progress towards ending cancer as we know it today. The White House for this effort is calling on the private sector, foundations, academia, healthcare providers, and really Americans at large to share their perspectives, actions, initiatives, ideas towards achieving this. And so on behalf of CodeX and our use cases, we are planning submissions on this effort. We encourage any folks interested in doing so to do that as well. I'll post some links in just a bit regarding the submission site and a fact sheet I found helpful in highlighting some of the priorities around this effort for anyone interested. Another quick shout out, we wanted to send a heartfelt thank you to Amgen on behalf of our trial matching team. Amgen recently awarded a nearly $1 million grant to support the use case pilot headed by ACS-CAN, the American Cancer Society Cancer Action Network, in partnership with CodeX. And this is our pilot involving integrated trial matching interventions intended to increase and diversify patient enrollment in cancer clinical trials. For anyone interested in learning further, we'll paste a link in the chat shortly, but really improving access and equity in trial matching. This pilot really speaks to our core values here at CodeX, and so we really feel privileged to be a part of this effort. Anthony is going to keep me on task, and so I just have 1 minute left. I wanted to also announce that we'll be hosting a FHIR shorthand ID authoring seminar sometime in mid-late May. The dates will be finalized shortly, and we'll make the formal announcement soon, but FHIR shorthand, or FISH, is really a domain-specific language that is really amazingly compact. It makes FHIR ID profiles almost like fun to write, painless. I can speak to this because I've actually done it myself. So if I can, you can do. So for anyone interested, keep a lookout for that event and share it broadly with anyone you think that will be interested. At a later date, we'll announce some use cases that we have in pre-discovery. We have not only the cases in genomics and REMS that we're going to discuss in today's committee of practice, but we also have ones involving health equity, revolving around a potential oncology case management use case concept, quality measures, structured clinical trials criteria, real-world data to support regulatory decision-making based on FDA guidance. In the cardiovascular disease domain developments, there's discussion of development of a longitudinal hypertension care use case. And so a lot of exciting developments. Anyone interested in connecting more about CodeX, please feel free to reach out to us at any time. And over to you, Anthony.
Thanks so much, Sue. And thanks, Liz, for the update as well. Okay, I'd now like to introduce the McGill team. John Kildea is an assistant professor of medical physics in the Gerald Bronfman Department of Oncology and interim co-director of the medical physics unit at McGill University. John's research focuses on building a software for patient-centered health informatics and experimental methods to examine the biophysics underlying radiation-induced carcinogenesis. At the Research Institute of the McGill University Health Center, John directs the research, development, and technology innovation activities for the Opal Health Informatics Group. He is PI of the Quebec SmartCare Consortium as well. And Kayla O'Sullivan-Steben is a graduate student in medical physics at McGill University under the supervision of John. She recently received her Master of Science degree, where she worked on a pilot project for patient-controlled sharing of radiotherapy data, and is now beginning her PhD, where she will focus on developing a patient digital twin model to predict radiation treatment response. John and Kayla, would you like me to drive the slides? Oh, okay, I'll just get that. I might not be able to give you access, John. Can you hear me, John? John, you able to hear me?
Hi, Anthony. Sorry, you had given me remote control, but somehow it removed all my controls. So I guess I'll let you do the control.
Oh, yep. Sorry about that.
No problem. So we can go to the next slide. So this presentation is really about Opal, the Opal patient portal, and how we're taking Opal to the next level with the Quebec SmartCare Consortium. And Kayla will present what she has been working on to bring the mCODE standard into Opal as part of the consortium's effort. So first of all, what is the Opal patient portal? It's essentially a platform that has got three components, really. It's got a component for patients, component for clinicians, and a component for researchers. So for patients, it allows patients to access their medical data with explanations and educational materials. It provides a mobile appointment check-in, and it provides the ability for patients to report their symptoms via symptom questionnaires and patient-reported outcomes. For clinicians, it's the other end of that spectrum, where clinicians have access to a virtual waiting room where they can manage the patients who are checking in using the application. It's got a virtual clinic dashboard, the ability for clinicians to monitor symptoms that are provided by patients using the patient-reported outcomes, and then also tools for clinicians to publish information, education materials to patients that then are automatically sent to patients based on their disease and their treatment. For researchers then, our vision, and this is really our long-term vision, is that Opal is a way to connect patients with their data, but then also to allow patients to participate in research and to provide data in a multi-institutional context for research. So as we know, the healthcare system is very fragmented. The data are in many different silos all over the place. Ultimately, we would like the patient to have access to all of their data from all of their the silos that they're housed in, and then allow the patient to share those data for the purpose of research, which would provide us with very deep, rich, connected data that we would be able to do real-world evidence research on. So this is our big vision, and the Quebec SmartCare Consortium is our effort to take the next steps in taking Opal from being where it is with patients and clinicians and bringing it to the realm of research. So next slide, please. And this is just a quick overview, a few screenshots of the Opal patient portal. And this is showing the account actually of Laurie Hendren, who was a patient and a computer science at McGill, who co-founded this project with myself and Dr. Tarek Hijal, who's a radiation oncologist at the McGill University Health Center. And as a result of Laurie's involvement as both a patient and a computer scientist, we've been making Opal very patient-centered from the start. Unfortunately, Laurie passed away from her cancer 2 years ago, but we have been working to continue her patient-centered legacy in the application. So next slide. Moving forward, we're building the Quebec SmartCare Consortium, and I'll show you in a few minutes the players that are involved in the consortium. But first of all, what do we mean by SmartCare? We mean the use of patient-centered data and mobile health technologies for remote monitoring and artificial intelligence research in healthcare. And this is the logo of the consortium, and it's a very deliberate logo with 4 colors. And each of these colors represents the stakeholders that are involved and the data and the healthcare system. So next slide. So first of all, we've got patients in green. Next. We've got clinicians in blue. Next. Researchers in red. And finally, we've got industry partners in orange. And these are all the partners that are coming together to make this consortium happen. So next slide. And Anthony, as I go forward here, I'm just going to say next, 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 and then you can fill this in for me. Okay. So the consortium, how are we taking Opal from where it is today to where we want it to be with patients, clinicians, researchers, and industry partners? So first of all, if we again go back to the colors, this is what we have today with Opal. We have a patient portal in the hands of patients. We've got the clinicians in blue in the healthcare system, and we've got the data that are being provided out to patients via the system that we've built in green, the Opal Patient Information Exchange and its